Mentioned National Cabinet meets this Friday with its primary focus being on a proposed overhaul of Medicare. The Prime Minister, Premiers and Chief Ministers will look at a number of ideas to expand the provision of primary care and address inefficiencies. Many of the finer details will be debated during the meeting. One of the core changes could see the duties of nurses, paramedics and pharmacies expanded to improve access to primary care. Among other things, this could empower pharmacists to treat patients or provide scripts for some ailments. Ahead of National Cabinet this Friday, I spoke a short time ago with the head of the Pharmacy Guild, Trent, where we began by discussing that proposal and whether he's encouraged by Premier Perrottet's support for an expansion of the role of pharmacists.
Well, what we know, Kieran, is that throwing more money at an already broken system is not going to deliver the reform that Australians need to meet their expectations. So it is very welcome to hear the New South Wales Premier acknowledge that his government is prepared to implement reform to remove regulation and red tape that prohibits the people of New South Wales from receiving a whole raft of services that they would normally wait up to 4 hours at their ED or 4 days to see their GP from their local community pharmacy. And this already follows the Palaszczuk government from starting this month their trial in northern Queensland. And it also follows election commitments given in the last Victorian state election that Premier Andrews is going to follow suit down there. So I really hope, mate, that tomorrow's meeting or Friday's meeting rather at National Cabinet isn't just having premiers and chief ministers with their hand out for more funds. It's actually them realising that a lot of the system reform that is needed is rests with them and their governments in reform at state and territory levels.
So, Trent, Twomey, what sort of conditions do the trials cover in terms of pharmacies prescribing? So give our viewers a sense of what those trials are dealing with already, and how broad is the scope, do you believe, for pharmacies to take on a greater responsibility, given the strain upon our GPs and the health system more broadly?
So this is about Australians receiving first world healthcare, the same level of healthcare that Canadians are receiving from their local pharmacy, that people in the United Kingdom are receiving from their local pharmacy. So it includes such things as the following. So instead of just being able to go to your pharmacy to receive your reliever puffer, you can get your preventative puffer. Instead of being able to go to your pharmacy to get the emergency contraceptive or the morning after pill, you can actually get your contraceptive pill. Instead of having to go and clog up an emergency department for a simple, uncomplicated urinary tract infection, you can receive antibiotics from your local community pharmacy. So these are common conditions, common ailments that are unnecessarily placing a burden on our emergency departments and on our GPs. And our highly skilled and highly trained GPs should be free to focus and have the time to deal with those more complex occasions of service. And unfortunately, our system, our wonderful federation, which has served us so well for so long, is no longer fit for purpose when it comes to health system reform. So this is exactly what National Cabinet's supposed to be about. It's supposed to be about reaching a national bargain that acknowledges the reforms that the Commonwealth can bring and the reforms that the states and territories can bring. So I just hope as we go in, it's not just about who shouldn't pay payroll tax and who needs more money on an MBS item number. I hope it's about genuine reform and increasing the amount of services an Australian can receive from their pharmacy.
Why are doctors' groups so concerned about this? You did mention that in comparable nations, pharmacies already have the scope that we're discussing this afternoon, but the doctors' groups have really pushed back against you and your arguments here, and the premiers that are seeking to undertake these trials. For example, the Royal College of GPs saying that it would create a conflict of interest for pharmacists if you were able to directly prescribe drugs to patients. What do you say to that?
Sure. So I go to my dentist every 6 months, and occasionally I have to get a filling. And when I was last doing negotiations with the Commonwealth, I ground my teeth so hard that I actually cracked one and I needed a crown. I don't go to one dentist and ask them to diagnose my problem and then go to another dentist to treat it. The dentist I speak to diagnoses the problem, offers me a range of solutions. Once I've consented, they provide that solution then and there to me in the chair. And that is exactly why we have the Pharmacy Board of Australia, the Medical Board of Australia, the Dental Board of Australia, that puts those safety guidelines and those professional practice standards around clinicians to make sure that the consumer is protected. But you're absolutely right, Kieran. Many Australians, and we know this, not just anecdotally from the conversations that I have with my patients and the conversations that pharmacists are having with their patients every day in every of the 6,000 community pharmacies around Australia, but we know it from research and we know it from focus groups. Australians are demanding our first world healthcare. They're demanding to put themselves at the centre of the healthcare system and for them to choose where they get their care and from what healthcare practitioner, not betting down on a broken model that puts practitioners at the centre and not patients at the centre.
The Royal College of General Practitioners says in a statement, this was responding to a speech you gave recently, they've said part of the skill of general practice is knowing when not to prescribe. The Pharmacy Guild seems to think that everything can be fixed with a drug. Pharmacists don't have the expertise and training to perform the function of prescribing medications. That is a job that should be left to medical practitioners. What's your response to that critique?
Listen, I think that's a cheap shot. That's based on their fear of their loss of control and is not based on the sheer weight of international evidence. We know that when pharmacists are given some extra training and to be able to do all these extra things on top of the 5 years of tertiary training pharmacists already have, they'll need to do another 12 months with university and doing on-the-job training. So it's not saying all pharmacists at the moment will do these things. It's about saying, yeah, sure, there is a gap in pharmacists' skill set and they will have to go back and get further training. But listen, the sheer evidence says pharmacists prescribe less often than GPs. And I know your viewers will know, just like all my patients know, that they go to, a 24-hour GP super clinic, or they get a dial a doctor, or they do an online consultation over the internet. Unfortunately, that model of care that dishes out antibiotics like lollies is not the model of care that they're looking for. And pharmacists say no more often than they say yes to providing medication as a service. And that's exactly what the international evidence says.
I know you've got to get going. Just one final question. Mark Butler has conceded the system is under the greatest pressure for 4 decades. Strengthening Medicare task force, due to hand back its, will have that report released within a couple of days. What's the key to the recommendations? What do you want to see out of that task force?
What we want to see is all healthcare practitioners, right? Whether it be your nurse, whether it be your pharmacist, practicing to their full clinical scope of practice, to utilise all the skills our wonderful nurses have, our wonderful pharmacists have, to be able to provide more services safely and effectively to Australians when they choose. What we don't want to see, Kieran, is a shuffling of deck chairs. If all they are going to do is create new MBS item numbers that takes physios out of physiotherapies and sticks them into GPs, that takes pharmacists out of pharmacies and stick them into GP surgeries, that is not system reform. That is not changing and broadening the services that Australians can receive from their healthcare practitioners. All that is doing is shuffling deck chairs amongst already existing buildings. So let's not rob Peter to pay Paul. Let's not cause damage to your physiotherapy or your pharmacy in order to try and save general practice. Sure, their problems need to be addressed, and I don't stand in the road of those. But what we're saying is Australians should be able to access a greater range of services from Australia's 6,000 community pharmacies and not bed down on a broken GP model.
Trent Twomey, Pharmacy Guild President, thank you for your time. We'll talk to you soon.
Thanks, Kieran.